Have you ever been weeks into a plan of care and had to change direction because you got new information? In today's episode, we're walking you through a neck pain evaluation subjective. We'll highlight key questions, discuss where a lot of therapists get stuck or go off track, so next time you won't. And action.
So first thing with the subjective examination, guys, put your computer away, okay? This is how we do our entire evaluation. We've got a piece of paper, right? A pen, and two humans looking each other in the eyeballs. And honestly, I don't really take too many notes because I don't want to be talking to them like this either. That's not really any better than like, okay, so tell me what's going on. So if there's something that you really need to jot it down, or if there's a transition period throughout the eval at some point in time, write it down. But they fill out intake paperwork beforehand, right?
You don't need to write full sentences either, just like quick note.
Yeah, that's it. So when we bring somebody back, we're already doing some evaluation as we're watching them, right? From the waiting area, wherever that is, back to wherever the evaluation area is. And then, before we dive into anything, Caitlin, I'm just curious to know, what are your expectations from today?
I want to figure out what's going on and try to get rid of my neck pain.
Tell me a little bit more about that. I want to help you get rid of your neck pain too, and I want to give you a full understanding. But I also want to know, just from today's session alone, what are you expecting to leave here with today?
I want to know why my neck hurts so bad and what I can do about it.
Okay, so understanding what's going on and knowing what the plan is.
Yeah.
Yeah, perfect. That's exactly my plan as well. So tell me a little bit more about, I know you have some neck pain going on. Tell me a little bit more about what the main problem is for you currently.
I've had to modify my workouts because my neck pain gets a lot worse when I have heavy overhead days.
Okay, and then what type of workouts do you do?
I've been doing a lot of Olympic lifting, and in that we've also just done strength progressions for like strict overhead press and squats and things like that.
Okay, so are you, I noticed you said currently you've been doing a lot of Olympic weightlifting. Does that mean that you typically do CrossFit and you're doing a lot of weightlifting, or you're just into weightlifting now, Olympic weightlifting?
Mostly into Olympic weightlifting, and then also some bodybuilding components.
Gotcha. Okay.
So like ollie lifting 3 days a week.
Gotcha. All right, so things like the snatch, pressing, push pressing, jerk, those are all painful for you. What about any of the bodybuilding style movements? Are any of those an issue for you?
Overhead pressing, and then honestly it's gotten to where like any kind of pressing.
Okay. How about things like upright rows, front raises, lateral raises? Are those ever bothersome, or are those pretty good?
Those have been bothersome too.
Yeah. Okay. Yeah, but it sounds like your primary concern is the overhead stuff,
Yeah.
right? I'm just trying to get a full picture of everything.
Everything just like gets tight and painful.
Okay. How long has this been going on for?
On and off for the last 6 months.
Okay. So throughout the 6 months, has it been more on, more off? Or a better question, how many episodes have you had over the last 6 months?
I don't know. Probably initially it was once or twice a month. And then after that, it started to be every week on Tuesday when I had my overhead day. But then it would get better in a couple of days and just go away. And so I would go back to it and then just lift heavy again the next Tuesday. And then now it's been like increasing the duration, and now it just hasn't gone away.
Gotcha. So it was kind of like the onset was the lifting that you're doing on Tuesdays. At first it was just a day or so ache, and then it kind of would stick around for a couple days. Now it's kind of always there.
Yeah.
Are there some ups and downs like throughout the day or different days?
Yeah, it definitely gets worse when I lift.
Yep.
And like by the end of the week, it's less bad, but there's like still something there. And so then now I'm starting my Tuesday lift at baseline with some issues, whereas before I was fine.
Mm-hmm. What days are you doing the Ollie lifting? Tuesdays?
Well, Tuesdays are my heavy overhead days.
Gotcha.
But Monday, Wednesday, and Thursday are my Olympic lifting days.
Oh, okay. So Tuesday is a strength day?
Yeah.
Do you have another strength day? Like, do you have a Tuesday, Thursday strength day? Like, what happens on Thursday? Oh, wait. Monday, Wednesday, Thursday, you said?
Yeah.
Sorry.
Or my ollie lifting.
My apologies. I wrote that down, and then I was just immediately filled in Monday, Wednesday, Friday. Do you do anything on Friday or over the weekend?
Friday is kind of a light Olympic lifting day and some accessory lifting. And then Saturday has been, my coach programmed like a shoulder rehab day
Okay.
to work on a lot of just accessory strength.
So that's important. Friday, with your light Ole and your accessory stuff, what type of accessory things are you doing there?
Like overhead carries and Turkish get-ups.
Okay.
And we'll do probably like 60 to 70% 1RM of some of my other lifts just at a higher volume.
All right. And then what about your shoulder rehab that they have you do on Saturday?
It's a lot of like external rotation strength, overhead holds, band pull aparts. There's one called a Serrano press. I mean, it hits shoulders hard, and I know I'm weak in a lot of it, so like I know I need to do it, but I'm very inconsistent with that day.
Okay. Yeah. Do you happen to have your program like in writing?
Yeah.
Okay, so we can go over that in a little bit, or you can send it to me, and I can kind of give you some feedback on some modifications as we're going through this, like week to week. Also, I didn't see your coach in your intake paperwork, so if we can get you to fill out like a HIPAA release, so we can just talk to them, we can make sure that this whole thing is a multifaceted approach, and we can make your training part of your rehab, and your rehab also training. So we're hitting it from all angles. Would that be okay?
Yeah.
Okay, cool. All right, so before this 6-month period of time where it's been bothering you, have you had an issue like this before at all?
Not exactly like this. Like, I feel like I've had periodic injuries over the last couple of years that's been in this area-ish.
Okay. How many times over the last couple of years?
2 or 3.
Okay. And then do you know like the activities that kind of cause those episodes of pain?
I've mostly been doing Olympic weightlifting, and usually it's been with like some kind of overhead movement. So I'm either doing a really heavy snatch or overhead presses. Yeah, I think those have been really the biggest things.
So it's not really just the last 6 months. This has kind of been, the overhead stuff has been a problem intermittently for a couple of years now.
Yeah, just with like different injuries, but then they go away.
Yeah, it's just kind of, that's the thing that kind of brings on the injuries every time, it seems like.
Yeah, I guess so.
Okay. And what about outside of weightlifting? Like, what are the kind of, well, we'll come back to that. Let's say right now, where do you feel the pain?
It's mostly like right here.
You can say that. I'm going to come look around here. So, right here.
Yeah.
Okay.
Right there.
And then do you have anything other than pain?
No, I mean, sometimes the pain will go, like it spreads a little bit, just like through the entire area. So it's not like pinpoint. It gets into my whole neck. My shoulders get tight. And then there have been times where my shoulder kind of hurts too.
Gotcha. So when you say your shoulder, where do you feel that when your shoulder hurts? Is it like back here, in the front?
It's more like right here, but it's like I can't pinpoint it.
Yeah. Is it, you ever feel it like down around the shoulder blade through here at all?
Yeah, on the other side. That was one of my original injuries.
Gotcha. Yeah, so either side. I'm just standing on this side, so I'm
Yeah.
touching over here. Or does it like go down the arm or into the hand fingers at all?
It hasn't gone all the way down the arm or like into the hand or fingers. It's mostly just like my neck and shoulders.
Okay, so it's like neck, down between the shoulder blades, nothing in the arm, the upper arm, or anything like that. Okay. And then, so no numbness, tingling, anything in the hands, nothing weird going on. Okay. And then the pain you're feeling, how would you describe that? Would it be more of a dull pain, sharp, achy, throbbing, burning, stabbing? Like what words would you use to describe the pain?
It's like everything's really tight and achy and fatigued.
Gotcha. So tight is the word you've heard you use a couple times. Is that kind of primarily how you would describe how you feel, or would you describe it as pain? And it's okay, because tightness is like a form of pain sometimes that people describe. I just want to know what your experience is like.
A lot of it is tightness, but then when it like spreads to my shoulder and it's in my neck, it gets to a point where it's like a really strong ache.
Yeah, and then it would be
Yeah.
painful, right? Okay, cool. If we were to look at this on a 24-hour clock, right? If we were to say, you know, and I know it's kind of related to the lifting, but now it's been up and down throughout the day, and it's been sticking around for the whole week. Is it typically worse in the morning, the middle of the day, towards the evening, or at night when you're trying to sleep?
It depends on like what day of the week it is. So if I did heavy overhead pressing, then first thing in the morning, it's really bad. But if it's the day before I did my overhead lifting, throughout the day, it's not terrible. But then around my workout is where it gets a little worse.
Yeah, so then the next morning you wake up, and so let's back up a little bit. Leading up to your workout, let's say you wake up and it's not that bad. That's what it sounds like when it's not, when it's been a few days since your heavy overhead, right? Throughout those days where you wake up and it's not too bad, does it get worse throughout the day, or does it kind of stay about the same?
It stays about the same until
You
I
do
lift.
something that pisses it off. Yeah, okay, cool. And then when you wake up in the morning after lifting, is it like exceptionally irritated for a period of time? Is it like the first hour that you're awake? Is it stick around all day really strong, or does it wake up really strong and kind of come down throughout the day?
It's most of the day. There have been times where I get to my Wednesday or like Wednesday and Thursday Olympic lifting session, and like I can't do it, and I have to modify because I can't like it hurts to get into the pulling.
Okay. How do you modify it?
I just don't do it, and I do something else.
Yeah. So
Yeah, I'm like doing box jumps, just like other explosive activities where I'm trying to still keep my power, but like I can't lift, like overhead hurts. It's been really frustrating.
Yeah, it sounds like it. What other types, when it's already irritated, what other types of like movements, activities, positions, or situations make it worse? For instance, how's it feel when you're driving, or if you're doing any computer work, or?
Yeah, I don't drive that much, but like carrying things to and from my job. So I carry like a big fat backpack. I carry a bag full of food and like extra clothes for the day because I get super cold. That kind of irritates it. And then I would say taking the dogs for a walk has been like weirdly irritating.
Okay. How long can you walk the dogs before it becomes an issue?
Well, it depends. If it's already flared up, then it's like pretty right away. And then other times it'll be like towards the end of a walk where I'm like, oh, that's weird.
How long are your walks typically?
45 minutes.
Okay. And I noticed the dogs was plural. How many dogs how many dogs do you have?
3.
How many are you walking all 3 at the same time?
I walk 2 at a time.
Okay, so like on the same hand, one in each hand.
They're both on my left, and I hold the leashes with my left hand, and then I kind of hold the slack with my right.
Okay. Are they tuggers? They tug?
A little bit.
Okay. A little bit or a lot of it?
Well, a little bit for one, a little bit for the other is kind of a lot of bit together.
Okay. All right. Yeah, that all makes total sense to me. I guess 2 more things I'm curious about is, one, when it's really bothering you, what do you do to make it less bad?
I just wait.
Okay. So there's no position or movement or anything that you find that like gives you any relief at all when it's really flared up? And it's okay if the answer is no.
No, not really. Like nothing that I've noticed.
Okay. And then, I always like to know what a home run goal for you would be, right? So to say that you came to Move Athletics and we absolutely crushed your goals and expectations, what is the one thing that we can like check the box and say you did it that says coming here is a success?
I want to get back to my Olympic weightlifting program so I can PR this year.
Okay. So setting a PR is a goal.
Yeah,
What are you trying to PR?
a snatch.
All right. What's your current snatch?
165,
What do you want to hit?
175.
All right. We're going to do it. We're going to do it in here.
Oh, shit.
Yeah.
Yeah, that'd be great.
All right, cool. Anything else that you think that I need to know about that I haven't asked about? Dope. All right, let's hop into the next part. And that's it, guys.
End scene.
So now let's talk about this, right? Because you might be wondering where I'm going with some of these questions and why I'm so particular with getting the information the way that I want, especially when it might feel like sometimes she's already answered some of those questions, because there is a big difference in patterns and behaviors and patients don't know the exact information that you're looking for, so you need to know the exact information that you're looking for. If you don't know exactly why you're asking the question and exactly what information you're looking to get, they could be giving you bad answers. You could be asking good questions and getting bad answers and not even know it, which is going to put you in a situation where later on they're going to say something kind of off the cuff and you're going to be like, oh, that makes a lot of sense and I've been going down the wrong road. I wish I knew that earlier.
The other thing too is if you're non-specific with your questions, then you're going to get all the information at once and it's going to come across as more confusing. So for instance, in that subjective, it's very different after a heavy lifting day on Tuesday compared to maybe Monday going into it. And if Roger had asked in general how it feels with training, I would have been like, oh, I don't know, sometimes it's this, sometimes it's that.
Yeah, and I want to know exactly what the pattern of her pain is. And that's what the point of this is. One, what are your expectations? Like, we need to know what her expectations are. You might think you know, right? But if she said, my expectations are to get dry needling today, and I don't do any dry needling, she's going to leave feeling extremely disappointed. And no matter how great of a job we did in the evaluation, we did not meet her expectations. If she's expecting some type of quick, crack of her neck or her mid-back or a massage or whatever crazy stuff is in her head that she thinks she might be getting today, if I don't ask her, then I don't know that. And if she were to say, well, I expect some dry needling today, I would respond in a way that maybe resets her expectations if I don't plan on doing dry needling. I could potentially leave it open. I would say, hey, totally understand that. And if that's okay, that might not be something we do today, because today really is all about finding out exactly what's going on, making sure you understand exactly what's going on, and you understand exactly what the plan is and why, so you can be more in control of your pain between now and the next time I see you, and we can actually create an environment within your body that's conducive to healing so you don't keep metaphorically picking at the scab. Is that okay with you? And then she would say, yeah, that's great. And now we've just realigned expectations, and now she expects what I told her is going to happen. What were you going to say?
And if you pay attention to the questions that he asked, they're all very specific, but what they're not are, what makes it better? What makes it worse? He asked in different ways and got the information to find out a number of things that make it worse, when it feels worse, and then the activities that I had found that have made it better, not really any.
Yeah, and I gave her permission to say no, or I don't know. Because a lot of people feel like I have to have an answer to this question, right? Or if you ask somebody, do you feel that, or what, anything at all, and they're like, oh yeah, maybe. And it's like, it's okay to say no. And then they're like, oh, thank God, no, nothing makes it better. It's always bad. Oh, okay. And we'll probably dig into that a little bit later on. There'll be some things that come up that like, oh, well, I lay down and it makes it feel a little bit better. But it's like, these are hard fucking questions, you guys, right? Like, what did you have for breakfast yesterday? You had to like stop and think about that. Never mind like, hey, how's your pain been behaving over the last 6 months, right? Like, hey, what did you do at 3 o'clock in the afternoon last Wednesday? You have no idea, right? Like, they're hard questions. So we have to like give people some leeway and help guide them around to thinking and figuring out what information we even need.
I think one of the other things is most people aren't aware when they've behaviorally started to do something that makes their pain better. They just started doing it unconsciously. So like a lot of people would maybe be like holding their arm like this if it's offloading their neck, or holding a hand here. A lot of people who have low back pain end up leaning back on their hands when they're sitting.
Or leaning forward on their hands.
Because it makes them feel better.
These are patterns and behavioral cues that you pick up on in the subjective that you can't ask about. You just have to know what to look for. Caitlin's right. Pretty much anytime somebody is holding onto their shirt, they hold onto their elbow, they unbutton their shirt and they put their hand in it, or they're up here, or they're up here, or they say, my shoulder hurts, and they indicate here. That's a neck thing. They're like, oh, I think I tore my rotator cuff. Feels so much better when I do this. And that's not, you can't ask about that, but that's the thing that makes it feel better. And they'll say nothing makes it feel better, but the second they let go of their elbow, they're like, oh my God, it hurts so much worse. Like, so you need the experience, and you need to kind of know these things, and you can pick up on the non-verbal communication that goes on as well. So when we're talking about what's your main problem presently, Well, she might have a bunch of issues going on. She might have been feeling differently when she scheduled the appointment. She might have been feeling differently when she filled out the intake paperwork, right? Like we've had plenty of people that come in and they're like, my knee hurts. And that's what they talk about when we're on the phone with them. And that's what they fill out in their intake paperwork. But by the time they come to their appointment in a day or two, they're like, my back is killing me now. Or vice versa. Like my back was hurting, now my knee is really killing me. So currently, like what are you dealing with right now over the last 24, 48 hours? Like tell me about that. And then we want to know, how long has that been going on? And you'll notice the way that I ask these questions, it started off with, oh, it's been going on for 6 months, to, oh, it's actually, I've had recurrent issues. Maybe they felt a little different, but the issues with the same lifts and the same positions, same activities in the same area for several years now, on and off, not 6 months, which is a very, very different. It gives me an idea of like acuity and response to stress. Activities that cause episodes, yes, I already knew that it was overhead lifting, right? But when I ask what other activities cause episodes, a lot of times you're going to get different information. People are going to come like, well, yeah, it's the lifting, it's this, and then it's like, well, actually, when I'm carrying my groceries in, when I've got my bag for work, when I've got this or that going on, like those also hurt. So it's like, all right, cool, we didn't know about that before, and I want to have an overreaching picture of what are all the things, right, that really make her pain worse. We went over the symptom locations, anything other than pain, right? We're looking for paresthesia, things that travel, because at first it was like she indicated just centered on her neck at like C7, and then she's like, oh, but actually it travels down, right? It goes between my shoulder blades. It's kind of diffuse. It's all over the place. It doesn't go in my arm, though. All right, cool. And then the 24-hour clock, that's super important, because again, that's patterns, that's pain behavior, right? Is it, if you wake up in the morning and you've got pain, there's two options there. One, you've slept in a shitty position, right? Or two, it's a movement-based problem. So if they open their eyes and they do not have pain, they have not yet moved and they do not have pain, right? Then that's not a movement issue. I'm sorry, that's not a positional issue. That's when they start moving, they're jacking themselves up. If they wake up and they're like, I haven't moved yet, it hurts, well then they're sleeping in a position that's provocative, right? So knowing exactly all of those little details to parse out and how to ask questions around it is going to get you the information that you need. And that is what expert clinicians do, you guys. And then just looking at whatever, I call it maps, right? Movements, activities, positions, situations, like that's the map to their pain. What are those? What else aggravates your pain? What do you do to alleviate it? They're going to tell you these things. And if nothing alleviates it, it's probably because it gets so freaking flared up that any input's irritating input, and it's like a forest fire where you just have to wait to put it out, right? You put out a campfire. Good luck putting out a forest fire, though. And then, dude, the home run goal. How do you know that you've accomplished anything in therapy if you don't know exactly the one thing that's measurable? That's why she said, I want to lift without pain. Like, yeah, it's cool, but like for how long? You can't ask that question because they're going to say forever, right? Like if you make it a month without training, without pain, is that a good goal? Are you going to be able to do that for them while they're still in rehab? So now I know, and maybe some of you guys are intimidated by that, but I just set an expectation that we're going to set her a 10-pound PR in rehab. And when we do that, we know that we have absolutely crushed her expectations. A 10-pound PR with no pain in rehab.
So then the next thing that we need to address is where a lot of therapists actually get off track in this process, because it's really easy to do that, especially when you have somebody who's really talkative and just wants to help and they jump in there and they give you all the information.
Yeah, somebody that has been through the ringer, that's seen multiple therapists, or they're like, they love Dr. Google and WebMD and they've looked at everything and they're great. Aunt Gertrude's told them what they think is going on and they want to give you all the information. They're trying to be as helpful as possible to you, but they just fucking ramble and go on and talk about such erroneous shit. Or sometimes they'll start talking about like their dog or something and you'll be able to pull them back on track.
So when you're asking somebody these questions, you're looking for specific pieces of information. You are able to filter through all of the information that they're giving you and take out the things that are important. For instance, when I was sitting here talking about pain with overhead and pain with this and pain with that and nothing makes it better and sometimes it's worse and sometimes it's better, What I can now do is paint a picture on a 24-hour clock. Now I know where the pain behavior is. I know that the days after lifting, it's worse immediately in the morning and all throughout the day. So when you're going through a subjective, you need to be asking specific questions because you're looking for specific information that's going to help you understand what's going on. If you start asking non-specific questions, or if you don't know what you're looking for, you're going to get a lot of information that's not going to help you, and it's going to be useless. So then you're going to spend all that time doing a subjective exam, and it's going to be a waste of time because you're not going to be any further into understanding what's going on with your patient.
Yeah, you're going to be at the end of it. You're going to have a whole bunch of useless information, and you're just going to be confused.
Diving down the rabbit hole of specific questions, if you don't get a good history and you only ask what's currently making it better, what's currently making it worse, and how it started, again, that's not a good history. Roger pulled out that I've been having this on and off for the last couple of years. And let's say I had seen a couple of other therapists and they hadn't asked more digging questions, they would have had no idea. They would have thought that this is a new injury that I've been dealing with for the last 6 months that's slowly been getting worse.
I also pulled out that she's doing a whole bunch of shit that are giving her that's probably making it worse in the form of accessory work and shoulder rehab, and doing a bunch of things that I'm hypothesizing at this point are contributing to her pain probably significantly.
So then when we're getting all that information, we have to be able to identify patterns. If you're familiar with mechanical stressors and you know how those work and how those affect the body and how they work when something's already irritated and flared up, you'll be able to see, oh, okay, they did this exercise, they loaded it a lot, and now they're in more pain. That makes sense. If you can add all of that together and get all your information in your pot, you'll be able to read between the lines of what they are unable to say because they don't yet have the education to understand why what's happening is happening. You get me?
But you need to know what you're looking for and what you're listening for. You need to know what information you want. You got to think of yourself as like a detective, right? And if you're doing an investigation on a homicide, maybe that's twisted, but whatever.
No. Inspector Gadget.
I was like, what was that noise for? You're doing an investigation with Inspector Gadget on homicide, who I would not want to do an investigation with. You need to know what information is useful. You're going to get a ton of information that isn't helpful, and you need to be able to weed through it and pinpoint and hone in on the things that are useful and know how to ask more questions about those things to get more useful information.
If any of this is new information or things that you know you struggle with this, schedule a call with us. We do completely free strategy sessions where we can help you figure out where the gaps in your clinical skill set are and make a plan for getting you from where you are to where you actually want to be.
Just click the link in the description below.